Shantha Rau Barriga is the founding director of the Disability Rights Division at Human Rights Watch. She joins us now via Skype from Brussels in Belgium. Thanks so much indeed for joining us. Watching that report is just heartbreaking, and the big question that I just was grappling with throughout is, why is this being done? In your investigations and coming up with this report, did you find an answer as why people do this?
Thank you, Peter. There are a number of reasons why shackling happens all around the world. For one, there's a failure of services provided by the government. And we're not just talking about mental health services, we're talking about job training, housing, education, counseling, therapies, so many ways of supporting someone who has a mental health condition or what we call a psychosocial disability. And that's one factor. On top of that, as I'm sure you know, there's much stigma and shame associated with mental health. And that leads families to hide away their loved ones, shackle them in their home, or take them to a spiritual healing center, to a faith healer, with the hope that they will be healed. And I think families don't do this because take this lightly. They actually are struggling to cope. And that also stems from the notion in many countries around the world, in Asia and Africa and Latin America, Middle East, that mental health is associated with being possessed by the devil, cursed, or that a sin is placed on you. And as you can see on the screen, this man in Kenya, now, when we interviewed him, you could hear the chains before you could see him. You heard a clink, clang as the man was approaching his home. And it's heartbreaking when you actually see and hear and experience what it might be like for someone. I met people living in chains for up to 10 years in a prayer camp in Ghana, living under a tree, denied food, only taking a bath once a month. We have to call it what it is, and it's torture, and UN experts have said so themselves.
I can only imagine that this kind of shackling, whatever mental health challenges many of these people are facing, are exacerbated by this kind of chaining.
Oh, exactly. I met so many people who've been chained for years, and I wondered if when they actually arrived in these centers or began to be chained at home, if they actually even had a mental health condition to the level that they do when I meet them. I'm sure that this causes so much trauma. I met a girl who was 5 years old in Ghana who was chained for 3 days. My colleague met a woman in Indonesia who was locked up in the family home, in a shed behind the family home for 15 years. Wow. And when she approached that, she could smell the stench of urine. She could see that whoever was living inside was living in darkness because there was no light. And when she peered through the boarded shed, she saw a woman crouched in the corner, naked, who was fed through a small hole in the wall of that building. And this is the conditions she lived in for 15 years. I can only imagine that her condition deteriorated, having been in that kind of environment.
What can be done? What should be done?
Good question. There are many things that can be done, and it starts with governments actually banning the practice of shackling, calling it illegal, and then making sure that there's actually an enforcement of this ban, visiting these facilities and making sure that they no longer practice chaining and such horrible conditions. Second, there needs to be an investment in the various kinds of supports that can allow people with the mental health condition to live on their own. Job training, housing, education, so many investments that benefit really everybody in society. And third, as I mentioned, stigma and shame are a huge issue that lead people to shackle their loved ones. So we need to tackle that. We need to find positive stories of people who have experienced shackling and are now actually productive members of our communities. We met a man in Liberia and he was shackled several years ago for 11 months. His family helped him come out of those chains, and now he's a school teacher in Liberia. I met a man named Felix in Ghana who was shackled under a tree for 5 years. We put pressure on the government of Ghana together with local groups, and he was actually freed from those chains and now lives on his own, but still needs a job, and he still needs supports, and those supports are not available. And governments are failing, and they need to act. But there's something that all of us can do as well. We've actually launched, in addition to the report, a campaign called #BreakTheChains. So all of you can go to the website, breakthatchains.org, and take a pledge that you're committed to seeing a world where people with psychosocial disabilities lived free of stigma and where these kinds of practices end. We hope that all of you can help us and join the fight to end this practice around the world.
I'm trying to understand how authorities have allowed this to happen for so long. If these people didn't have these mental health disabilities and they were normal people and they were chained, there would be such an outcry and people would be jailed.
You're absolutely right, Peter. And that's what's so shocking about this, is I've found again and again that man in Kenya whom we met, he said to us, who has been chained for 5 years and still is living in chains. He told us, this is not how a human being should be treated. A human being should be free. And that's what I found in so many countries, is that people see someone with a psychosocial disability as less than human. They don't see them as an equal human being. But in fact, you or I could have a mental health condition. Any one of us could experience that in our life. It is actually normal to have a psychosocial disability. It's actually 1 in 10 people around the world, according to the World Health Organization, who do have a mental health condition. So what we need to do is break the stigma and break the shame and break the harmful practices, including the chains, and make sure that people are part of our communities and are treated just with dignity, just like you and I would want to be if we were in that position.
You mentioned a few examples and a number of countries, but I just wonder, how widespread is this problem on the continent? Are there many, many countries on the continent that need to tackle this issue?
Absolutely. We've found the practice of shackling in 60 countries around the world, and many of them in Africa and in Asia, particularly in Africa, in Kenya, Nigeria, Ghana, Somaliland, Mozambique, across the continent, north, south, east. We've found that this practice continues, and I'm sure there are probably even more cases that we don't even know of yet. We just documented a case just 2 weeks ago in Tanzania of a young boy who was held by a chain in his family home. And so we're coming across these cases, and part of it is that this practice is hidden. And so we are hoping that by exposing that this exists, we'll find more and more, and we'll realize just even more how widespread it is, and can work together to try to end it.
And I'm hoping that, freeing these people, that there is rehabilitation and there's treatment that you've seen, and once it's made available, that there's huge changes in these people's lives.
There can be. I mean, part of it is just freeing them from conditions that are just inhumane. It's not really about medications. It's about supports. I think having met so many people, I started working on this issue back in 2011. So I've seen so many people who were in chains, who have mental health conditions, but are thriving now because they have the space, they have the support, their family has accepted them, and those aspects of our life go a far way. The trauma associated with being in such conditions and not being accepted by your family. We met a man in Indonesia named Sodikin, and he was kept in a shed behind the family home simply because medications had run out. He wanted to take the medication, but there was nothing available in his community. And the nearest hospital was 2 days or 3 days walk that the family couldn't do all the time. But because of local organizations in Indonesia, he was actually freed. But and in fact, he became the family breadwinner. He ended up supporting his family, working in a factory to make school uniforms. And it was an empowering story, and we need to hear more of this. But also, I think there's an important link to make with the current COVID pandemic, because in situations like this in Indonesia, this young man named Sodikin, because of the pandemic and the limited resources and the disruption of services, he's actually not been able to get the supports he was getting, and now has been locked away in his family's home once again. So, there's a real need to call attention to this issue right now, in particular with what's going on in the world, because sadly, people with psychosocial disabilities are often marginalized and isolated and invisible, frankly. And we hope that this report and this campaign, #BreakTheChains, gives them a voice and tells their stories and allows them to enjoy life just like you or I.
All right, we've run out of time, sadly, but I'm going to give you just one more chance again. How can we all help? Because I do think that this is something that society as a whole has to embrace. What can we do?
Thank you. What each of you can do is take this pledge, and I hope you take it too, Peter, after the show, to be a part of this collective movement. And you can do so by going to break-the-chains.org, and you can take a pledge committing to ending this practice in any way that you can, and that includes ending the stigma and the shame that might be in your families. You might know someone in your family who has a mental health condition. We've gotten cases of people from all over the world who said, yes, my uncle was held in a room and chained, but we were not allowed to go in there. People told us their cousins or their sisters or their fathers were held in such conditions, but there was so much shame and stigma. And so all of you can have conversations at home and try to shift the way we look at mental health and understand that it's actually a very normal part of our human existence, and we should embrace the difference and instead invite people with psychosocial disabilities to be part of our communities and see how rich our communities will be.
Shantha, thank you very much indeed, and we wish you strength, and let's hope that we can all build this movement, break the chains, and just include all of our citizens, no matter what conditions they may be enduring. Thanks so much indeed for bringing this story to our attention.
Thank you so much, Peter.